And we are very grateful to have convened all the stakeholders today. We have had the UNAIDS, the ILO, the COTU, the Ministry of Health, the Ministry of Labor. We've also had the AMREF here. So multiple stakeholders, the CDC, are here just to look at what can we do for healthcare. And one of the things that the PS highlighted is some of the issues why health workers are actually out themselves is because they are looking for their own health and safety. They are looking for what they can do for themselves first, so that I have to be healthy for me to go to the hospital. But this is also coming at a very unfortunate time for the country. Unfortunate time because for the whole of this year, for about 240 days, we have not had any healthcare in the public sector. And when we talk about healthcare in the public sector, we don't just mean the presence of the doctor or the nurse at the facility when you go there for help. We mean even community, even promotional, So the effects of all of these struggles and strikes in the health sector is that even the person who would otherwise come to the hospital will not come because they think that the hospital is not functional. And that's the truth, the hospitals are not functional. So essentially, the whole of the public health sector is stagnant. It's not functional, and it has not been functional for 240 days this year. And the public health sector, our plea is that it should not be let to die, because right now you can see recently we had the cholera outbreak, now we're having the malaria outbreak. Let me tell you about malaria and cholera outbreak. Malaria and cholera outbreak are sanitation issues, are issues of public health promotion, are issues of just health workers going to the community, telling people clear these bushes, sleep under mosquito net, let's spray our bushes. They don't require a lot of expenses to manage. Just good water supply, no stagnant water here. Let's slash our bushes. Let's make sure we sleep under mosquito net. Let's wash our hands, And now to have many people, right now 4 counties, but actually from the doctors we have about 8 counties because we get report even before the Ministry of Health. It's our doctors that work there, and therefore there are more places than just Baringo. And now the other problem is that because the health workers are not in the hospitals, we may actually be missing even more counties, which have malaria. So even the reporting is not in itself accurate. The truth is that we are having a crisis in the system, and for us, the health sector is on its deathbed. Our plea to the president is, please, look into this sector again. It really pains some of us, who come from those backgrounds as everyone else, to see a system where the majority of the people, 40 million Kenyans, 90% of us rely on. One of the data that have never been talked about, one of the statistics which there is research about, is during the strikes by doctors and even the nurses, the private facilities here, I mean the registered private facilities and hospitals, have not experienced any increase in the number of patients. That means that these people are dying at home because they are also not going anywhere. What has happened is that they are mushrooming of some things behind bars called clinics, and these are not these are purely quacks, who are taking advantage, and the people are disparate. Recently, a few MPs have reached out to me, 5 MPs that we were meeting yesterday, telling me that their constituents are suffering so much that they want to help, but they don't know how, because one of them was telling me about a story in Tarakaniti where he found a child being treated behind a bar and they were giving blood. And those are things that should happen in hospital. And when they were talking to the person, the guy said, I'm not a doctor, so I can't keep staying here. But you see, why are they even treating people? So, what we consider small issues are actually big issues. The nurses strike, the clinical officer strike, and we as a union have, and we mentioned it here, we've tried to mediate and to engage the government and telling the government these issues can be solved. People can talk, we cannot neglect an issue, because if the clinical officers and the nurses are out, you can be sure the dispensaries, the level 3 hospitals don't have any staff. These are the same staff that usually go out to teach the community. So it is not surprising that we have this malaria outbreak and that we have malaria deaths. This this century people dying of malaria. First of all, prevention is very cheap. But secondly, treating it is also cheap. So you just need the health worker to treat it. Treating malaria is 40 bob. So why should someone have a life lost because someone who is supposed to provide medicine of 40 shillings is unavailable. I think we are doing our people a disservice, and the people should also wake up. I think we are also doing ourselves a disservice. We are doing healthcare a disservice, and we as the doctors are calling upon the people. Let's wake up and talk to our leaders. You can't just be quiet. Your MCA is there, the hospital is closed, the MP, the governors, and there's this grandstanding in the country. Maybe because of politics or whatever it is. It's useless. It's stupid, actually. It's stupid because this country is not divided. This country has the same issues. I told you the MP is from Tarakaniti, and I was equally talking to Dr. Nikal, the MP for Seme. Same issues, same problems. There's absolutely zero division when it comes to healthcare. People want just that. When you talk about Baringo, for example, and you talk about Vihiga, so what is the division there? Let's make sure that our healthcare is okay, and you start by providing the people who are the health workers. And for us doctors, we are overstrained right now, and a number of doctors have left the service. A number of doctors, I mentioned to you what we are discussing today, are also dying, and they are saying, I can't keep on in this system. Nurses are out, clinical officers are out. There is something that is needed to address the issues of the health workers, so that they can go back to hospital and then provide this cheap treatment of affordable, so that we are not losing 50, 60 people in a county because of malaria. So I think there's an urgent call for everyone to wake up, starting with our leadership. I think our leadership is doing what is called neglect management on the health sector. And I'm very glad that the Ministry of Health has now joined us, and they are talking about a fully engaged workforce. And this realization for us, we as a union are willing to help them the way we've been willing to help them bring the people on the table. We have brought the clinical officers back on the table, and we are hopeful that they will end their strike today, because we have been mediating with the PS and the union. We are also trying to engage the nurses and also the government, just to make sure this issue is sorted out, because it must be sorted out. The country cannot continue with no health care for one whole year. The effects, immunization, forget about even the polio, the malaria and the cholera. The effects that we are going to be seeing in 2-3 years' time, it's going to be costly. We are having children that are being born without assistance from midwife, and therefore we are going to be seeing more cases of disability, more cases of cerebral palsy, more cases of polio, because people are not being vaccinated. In the next 5 years, we should actually prepare for a TB outbreak in this country, because we are not vaccinating people for TB. We are not giving children any, just deworming. So we should prepare for a lot of blood shortages, because the worms suck blood, So the effects in the economy is huge. It's huge, because healthcare is everything. So my plea to the president, my plea to the leaders of whatever category at the governance level, let's stop this grandstanding. Let's sit down with the professionals, because we know what we need to do. Yes, and we equally understand that they are leaders. We equally understand the budget system. These things are all cheap. We can come together and give health to our people, so that people are not dying of malaria.